All right, hi everyone. So today I'm going to start another round of the NEET revision series, and I'll take topic wise till your NEET exam. So today's topic is anatomy, physiology, and basic investigations with embryology as well. So the rule is that we will. I'll just share my screen. Okay, I'll just check myself whether it's visible to me or not. Just give me a minute, please. All right, fine. Yeah, so rule is there are 10 questions now, and I'm going to give one question at a time, and I'll give you a specific time. According to the question, I'll give the stipulated time. You may not write anything in the live chat. I've not closed the live chat, so no need to write. After the 10 questions I've shown, then I'll discuss those 10 questions in a quick manner. That is how, in that discussion, then you can ask questions during the discussion, or I'll reply after that. Then you can write down, showing the 10 questions. Why? Because those people who are, those students who are listening live, they can answer yes. But those who see as a recorded version, they'll also be able to self-evaluate that how many questions they have done correct. Now it is all only for self-evaluation. There's no ranking system here, right? It's only for self-evaluation on how many questions you can get correct in this basics anatomy, physiology, investigations. So I'm going to start with the first question. I'm not saying anything. I'm giving time for you to solve the question. Don't write anything in the chat. Nothing to write. Just try to solve, and you can make your own note that one question which answer, two question which answer, three question. Then when I will tell you the answer, then you can match which question you have done right, or you can have a memory also for that and see how many questions you have done correct. All right, best of luck. Let's start with the first question. Second question. Third question. I'll give a little bit more in this. I hope it is clearly visible, right? This is quite. Just tell me this. Those who are live. Yeah, sure. Okay, I'll go for the fourth question now. I think that's okay. Time for this. Question number 5 is coming up. Should be okay for this. 6 is the next one. Okay. 7 coming up. Should be okay. If you know, then you know that. Question 8. No need to answer, Avik. No need to answer. Ninth question is coming. Yeah. And now the 10th questions. 10th question, I have not given the answer. This I will discuss live. Identify what structure is this. I'm not giving options for this. And this I'll discuss at the last because it was a slightly higher level question. So let us now see the discussion starting with the first one. Let us discuss the five. So the word tunica in English means layer. Layer of vasculosa is a layer that is a uvea. It contains iris, it contains ciliary body, it contains choroid. So answer to the first question is retina is the answer. It is a tunica nervosa layer, the innermost layer of the retina. That is the first question, retina. Tunica fibrosa, tunica vasculosa, tunica nervosa, three layers are there. Second question, you identify this chart is known as early treatment of diabetic retinopathy study chart done from 4 meters. It is also known as logarithmic of MAR, minimal angle of resolution chart. Contrast is same, color is same. This is for the shape and size, that is a form sense. Not for visual acuity in a child, this is for visual acuity uh, in amblyopia patients, and it is better for research people as well because of a phenomena known as crowding phenomena. It is a better chart for lazy eye individuals, not lazy people, lazy eye individuals. Third question, a myopic of 4 diopter comes to clinic, recent under floaters. Doctor want to see the retina to rule out retina hole or tear, which can have floaters because of vitreous hemorrhage as well. But he was able to see the retina. Fundoscopy was done, and in fundoscopy, because he has to see the entire retina, indirect ophthalmoscopy, the magnification of fundoscopy is given by power of eye of patient divided by power of the lens used. That is should be known. Lens is given to you 20 diopter. The 4 diopter myopia means the rays are converged before the retina. The converging power on normal emetropic is 60 diopters, 44 by cornea, 16 by lens. For a myopia, the power of eye is 60 plus 4 diopters, 64 diopters. So you have good in math. 64 divided by 20, answer is 3.2 times magnification. But these are condensing lenses used. In a condensing lens used, the image seen by the retina doctor is real and inverted. So answer of this question is real inverted image, and here it is between the condensing lens and the doctor the image is seen 3.2 time magnification. That is how we solved. Magnification of direct ophthalmoscopy is power of eye of patient divided by 4. Good answer. Now for say this patient of glaucoma, in glaucoma we have to see the optic disc. Which of the following is used to see the optic disc? Distant direct ophthalmoscopy is for the reflex in the patient's eye. Retinoscopy is for the retina refraction, refractive error testing. Indirect ophthalmoscopy can see the optic disc, yes, but the magnification is very less. So here the answer is direct ophthalmoscopy. But the best answer for optic disc evaluation is slit lamp with the condensing lenses. Here is not the option, so A is the answer. Now, all are draining in the superior ophthalmic vein. Superior inferior ophthalmic vein goes outside the orbit via the superior orbital fissure, upper and the lower part. They go into cavernous sinus. The draining of superior ophthalmic vein are the two superior vortex veins, supratemporal, supranasal, and central little vein. Inferior temporal vein drains into inferior ophthalmic vein. That's the answer of this question. Now, child is 134 weeks of gestation. Ophthalmologist reviewer sought to look for eye abnormalities. Doctor observed a glial tissue at the optic disc. Now, glial tissue at the optic disc. What could be the answer? Answer is papilla, bird's misted papilla. and that is a remnant of the primary vitreous, hyaloid vessel. Entire hyaloid vessel persists, that is known as persistent hypoplastic primary vitreous. If the anterior persists, which is touching the lens, behind the lens, that is mitten of dot, this answer is Burns Mister papilla. This is asymptomatic condition. Now, what is the pathway shown over here? And it is going not in the brain, it is going into the, this is the midbrain, pretectal nucleus. Then it goes into Edinger Westphal, and the arrow it is taking back, going into the iris. Now, this is not a visual pathway because the occipital cortex is not shown. This is not sympathetic pathway because sympathetic pathway starts from the brain, then hypothalamus to suprasphical ganglion by the apex of the lung into the eye. This is not a near pathway because in near also the visual cortex is taking role. This is a light reflex of the pupillary pathway. It's a parasympathetic pathway. Optic nerve is the afferent and bilateral third nerve are the efferent. And it goes via which ganglion? Ciliary ganglion. That is a one question as well. Now, near vision charts is done with both eyes together because accommodation is bilateral phenomena. It can be Snellen's, Jaggers, and Roman's chart. Snellen's can be far as well as near chart. Far vision chart is done one eye at a time, while near vision chart is done both eye at a time. It is a subjective testing. Patient tells how much he can see or not. Now, cycloplegic drop. Cycloplegic will relax the ciliary body. Accommodation is lost. So it's not done with cycloplegic drop, of course. That is a wrong and the correct answer over here. Good, Devanshi. Now, annulus of Zen, you should know, is present. Oh, no, it's not annululus. Sorry, it's annulus of Zen. That is a fibrous sheath in the apex of the orbit. It encompasses SOF middle part and the optic canal. Optic canal passes second nerve, so that's the answer. And the middle part of SOF passes NOOA, nasociliary, oculomotor 2 divisions and abducens. Means third nerve and sixth nerve also passes. Fourth nerve passes from the upper part of the SOF. Now, upper part in anatomy, they also say the lateral part. The lower part is the medial part. From middle part is NOOA, and from optic canal, second nerve passes. Both are in the encompassing the annulus of Zen. Fourth is outside the Zen. And now the 10th question was, now you can type in which structure is this. Let us see, slightly difficult one, but which structure do you think is this one? Now, how do you say this is? Actually, this is what? This is the eyeball, which is taking a lateral view. Left eyeball, because this is, if you see this muscle is superior rectus, but this is a trochlea. And from trochlea, it is coming to the temporal part, superior oblique muscle. This is inferior oblique muscle. So it is the lateral rectus. It's taking from the lateral view. And this is the optic nerve. This is the ganglion, which I was mentioning in the parasympathetic ganglion. Yes, excellent answer, Sonal, Garima, Akshat, Swati, Khushbu. This is your, yes, ciliary ganglion, Sahil. That is the correct answer over here. That is involved in the parasympathetic pathway. It's a parasympathetic ganglion. From here, the short ciliary nerve goes via the nerve to inferior oblique and supplies the sphincter muscle, causing bilateral pupillary constriction in the parasympathetic pathway. These are the 10 questions. Let me know how many you have got correct now. That is a self-evaluation. And that's for today's quiz. Swati 9 is good. Kushbu 8, try to do better. Okay, I'll give more time. 8, 9, 8, 9. Yeah, good. That's good. 8, 9 is good. 7 is saying why his question was got wrong. Myopia is more converging power. That is 64. Chetan, excellent. 10 on 10. Excellent answer. Shruti, 8 is good. 8 above is good answer. All right. I think thanks a lot. Those who are seeing recorded afterwards. Best of them to them as well. And we'll see in Telegram group. All right. Best wishes. Bye-bye.